Now, today we'll be discussing about a very interesting and very common topic, and that is constipation. Now, the thing is, why constipation is significantly common in hospitalized patients or in OPD cases. For that, we need to understand one simple thing that what do you mean by constipation? Now, constipation means that normally this is a small intestine which we can see. Most of this is the abdomen, where in the center we usually have small intestine, and in this peripheral region we have large intestine. So what we have here is cecum, and above cecum we have ascending colon. So this is all ascending colon. We have then transverse colon here because it is transverse, and then we have descending colon, and then we have sigmoid colon which has a sigmoid like shape, S like shape, then rectum where the stool is accumulated, kept, and then anus canal where the stool is thrown out. So what is the problem? This to say or to excrete this feces, we should have a good muscle contractility, because this all is muscle only. This ascending colon, this transverse colon, this descending colon, this is all muscle only. So to push this stool out, we have some basic requirement. For example, we need to have a good quality stool. So for forming a good quality stool, there should be enough fibers. The food should not be much dry. There should be sufficient water intake. So water intake at least more than 2 liter is more than sufficient for a good quality stool. Watery food like fruits, vegetable, high fiber contents like fruits, vegetable, they can give us a good quality stool. So this is one of the most important thing. And the other thing is these gut, these small intestine and large intestine should be having that much strength or power to propel this stool forward. So if the food has come in the stomach, then it should be propelled forward every time, every time, every time, every time. Then it should go here, then it should go here. So there should be enough power of these gut muscles to push this stool in a forward direction. So if you have enough fibers, if you have enough water, if you have enough stool volume, it becomes very easy for this mm, muscles to push the food forward. But if the stool quantity is very low, this will not be effectively pushing the stool forward. That is the reason why very commonly, if the patients have very bad habits, especially if the patients do have a tendency to take spicy food, oily food, or very much salty food, or deeply fried food, they may have constipation. Or if the patients have tendency to drink very less water, especially less than a liter, then definitely they have tendency to have constipation. If patients do have significant uh, intake, suppose if patient take breakfast, if patient take lunch, dinner, and if all these uh, meals are pretty heavy, then definitely they won't be having any constipation issue, because they will continuously get food into the gut, so that a large volume of stool is very commonly formed and patient don't get constipation. Now in medical setup, one of the most important disease is diabetes. Now what happens in diabetes? Diabetes actually causes hyperglycemia. There are so many things, but most of the important thing which diabetes causes, diabetes does not spare any tissue in the body. So it will damage kidneys, it will damage heart, it will damage retina, it will damage mainly muscles, it will damage neurons. So we know over a period of time these muscles are damaged, or the strength of these muscles is significantly impaired. The number of mitochondria in the muscle is significantly impaired. The muscle overall is significantly impaired over a period of time, over a period of years. More is the year, more is the muscle damage. And neurons, the same way, the neurons which are supplying to the muscles are also damaged over a period of time, over a period of years in diabetes. And more is the uncontrolled diabetes, more is the damage. So if sugars are well controlled, the damage will be less. But if it is uncontrolled DM, because to propel this food forward, we need muscle power. So normally also these muscles are very very small, and in diabetes these muscles are significantly damaged, which we call it as enteropathy, diabetic enteropathy, or diabetic gastropathy. And to have this muscle contraction, we need the supply from the vagus, the parasympathetic supply. So this vagus nerve actually causes release of acetylcholine, which in fact causes contraction of the gut muscles. But in this diabetes, this vagus nerve endings, acetylcholine uh, intensity or the quantity gets significantly damaged, gets significantly depleted. That is the reason why the nerve stimulation for this stool passage forward is very, very low. The acetylcholine for the stool forward direction is very, very low. So the contraction is very low. That is the reason why this, especially diabetic patients, very, very commonly have constipation. Now there are so many drug and stresses also. Stresses and drugs, like any surgery, mostly if it is in uh, general anesthesia, most of the general anesthetic like ketamine, like propofol, or the adjuvant drug which are used like succinylcholine, atracurium, uh, vecuronium. These are the paralytic agents which are used for inducing drugs like midazolam. These drugs, they are kind of highly lipophilic. It means they get accumulated in the fat, and one of the most large area of fat which is seen is in the abdomen, where we have fat and omentum. And these drugs, they have very very common tendency of causing gastroparesis or gut paralysis. So these drugs, these does not commonly get easily excreted, means they do get, but they have tendency to remain functional because they are highly lipophilic, and mostly they stay in this omental fat. So these drugs very commonly increase the constipation. And other drugs which very commonly are used in medical field, like tramadol, very commonly causes constipation. Fentanyl very commonly causes uh, constipation. Morphine very commonly causes constipation. Fluoroquinolone group like ofloxacin, levofloxacin, ciprofloxacin very commonly cause constipation. The various antibiotics like meropenem or cephalosporins can very commonly cause constipation. So there are so many drugs which actually has a significant tendency of causing constipation. So in this X-ray, what we can very clearly say is the overall, both small as well as large intestine, it is significantly dilated. If you can see, as I have told, if you want to localize small intestine, it is around in the center of the abdomen, whereas large intestine here, this is the ascending colon area, this is the transverse colon area, and then this is the descending colon area. And from here to here, we have sigmoid colon, then rectum, and then anus. So if you want to simply recognize small intestine, The small intestine have a small caliber, small diameter, whereas large intestine has a large caliber. This large intestine has hostrations. So hostrations are the large curved areas which are called hostrations. So these are all hostrations which recognizes, which tells us that this is descending colon portion. Whereas over that we can see a small intestine area. If you can very closely see, it is a spring coil-like appearance. See here, it is very well visible that it is spring coil type of appearance, which is a small intestine. Whereas large intestine is has these hostrations. These are large curved markings of that large intestine. So this constipation is extremely common problem, and there are so many reasons that we discussed. And thanks for watching.